It's crucial to sustain what we have. It's critical because of how the peculiarity of HIV/AIDS.
There is no way we can continue to sustain HIV funding, to sustain HIV response nationwide without active participation of the states.
Nigeria has made substantive advancements in the management of and fight against HIV and AIDS through the National Agency for the Control of AIDS, NACA, charged with the mandate to plan and coordinate activities of the various sectors in the National Response Strategic Framework. The success rate can be attributed to the fact that 90% of HIV and AIDS interventions in Nigeria are funded by foreign donors. However, in light of dwindling resources as a result of decline in these fundings, how ready is the country to own and sustain the HIV response?
We have to change the way we do business, and one area is our procurement system. We're buying directly from manufacturers. The manufacturers are giving us at price half the vendors or contractors are giving us. So in the light of the scarce resource we have at the disposal, we cannot afford to continue buying these drugs or sourcing these drugs via middlemen. So that's the decision we have taken. And another decision is the establishment of HIV Trust Fund. And if it comes, it's going to be private sector driven, and it's going to help a lot, in terms of supporting procurement of the essential medicine and commodities as well as logistics. The third layer we are looking at is putting the states in the driver's seat. There is no way we can continue to sustain HIV funding, to sustain HIV response nationwide without active participation of the states.
The civil society equally has a stake in the country ownership and sustainability of the HIV response.
As an implementing partner, I'll rate NACA 8/10. And that's really very high because of the many challenges they still have to contend with. Recently, they started the zonal offices, they're having a zonal presence, not just in Abuja, so that each zone there's a NACA presence. They can coordinate, because their job basically is to coordinate the intervention, and that's a big one. And again, in terms of rallying partnerships together, bringing people together to have like a singular focus, it's important. So they have done these things very well. The current DG, for instance, again, came with this very beautiful innovation. We have in the data, we have like a central data repository for all HIV management in the country in one warehouse, under one household. I think these are crucial efforts. Of course, it's not just NACA. The IPs are doing wonderfully. PEPFAR is supporting the program. Global Fund is supporting the program. But PEPFAR, NACA has done very well. And I zeroed out to the quality of leadership that they have.
Today, the subject of sustainability of HIV and AIDS interventions is not complete without mention of the impact of the COVID-19 pandemic.
We've managed to keep HIV positive individuals now away from hospitals. We have worked with care providers. We have worked with our implementing partners to introduce what we call multi-month dispensing. You're HIV positive, you come for your drug refill, we give you for 3 months. That will keep you away from the hospital environment and possible exposure to COVID-19 because of crowd that is involved. The COVID-19 sort of dragged us back, but we are coming back. I can vividly remember those 2 months or 3 months, that were affected by the lockdown, especially April and May. Our output in terms of the number of patients we identify and put on treatment, it was halved. It was reduced by half. So it has impacted that effort. But gradually, we are now coming back to normalcy. We are identifying close to exactly the number we target every month to identify. And this is commendable, especially the effort by our development partners who are out there in the community, as well as in the facility, looking out for new HIV cases and for people that have the disease that are not on treatment, bringing them to take medication.
If Nigeria plans to attain sustainability, effective resource planning and mobilization, backed up by strong political will, is crucial.
These structures must be put in place now, and that is why we are beginning at this moment to put the structures in place with one, states driving the response, HIV Trust Fund coming in, we changing the way we do business and buying drugs directly from manufacturers instead of buying from middlemen to get value for money, and make sure every single naira that is put towards buying drugs and commodities for HIV drives maximum benefit, for the patients, and drive maximum benefit for our system, for the nation. That's what we have now at the moment in terms of our sustainability plan. Going forward, by the time we test this strategy and see how the strategies add up, any gap that emerges subsequently, we now find out ways to fill in those gaps. But we must begin somewhere.